everyone. It's Melissa Peters here with Dorne Companies, coming to you pain-free live to help you live pain and injury-free. Thank you for tuning in today for another episode of the Injury Prevention Academy, brought to you by Dorne Companies, the country's leading wellness-based pain management and injury prevention company, committed to reducing costs of healthcare, workers' compensation, and lost productivity, resulting in over $100 million in savings over the last 20 years for our clients. Joining us today is Dr. David Neuman, who is the founder of PopDoc.com. David is a highly accomplished senior executive, entrepreneur, consultant, clinical director, and orthopedic surgeon with 23 years of success in sports medicine, healthcare, medtech, medical research, wellness, and fitness. Dr. Neuman specialized in general arthroscopic surgery with a sports medicine philosophy. His practice philosophy includes utilizing physical therapy and home exercises to help an injured joint recover to a functional state. His primary goal as an orthopedic surgeon is to help people diminish pain and increase the function of a damaged joint. Dr. Neuman believes that health and fitness are an important part of everyday life. Well, so do we, David. So thank you for joining us today. How are you doing?
So great to be here, Melissa. I really appreciate the opportunity. I'm doing fantastic. I'm loving
That
it.
is
Thank you.
great to hear. So let's just dive right in. So first and foremost, obviously from that bio, you have had quite a career journey. So I mentioned you worked as an orthopedic surgeon. So can you tell us a little bit about your career trajectory and how this ultimately inspired you to create PopDoc.com?
Certainly, I think that's a great starting question. I grew up as a young athlete, and I realized from a young age the benefits of routine and staying strong, flexible, and mobile is an important part of an everyday active lifestyle. In addition, on a sporting team, you get to hang out with like-minded people. There's camaraderie. There's the emotions of winning and losing. Athletes, unfortunately, sometimes get injured. So I suffered some orthopedic injuries. I was an orthopedic patient. And so I understood the struggles to get back to my comfort and my pain-free lifestyle. And as an orthopedic surgeon for about 15 years, I was operating on shoulder, knees, and ankles, seeing joint damage from the inside, and firsthand seeing all these problems from young people, middle-aged people, whomever. Joint pain was a big part of my practice. As a young man, I was an avid skier and I injured my thumb, but like many Americans, I pushed through the pain for the love of the game. About 8 months after I should have, I finally had a doctor look at it and I had surgery. So it got me back to a functional level. But after about 25 years, my thumb broke down in a sense where it was painful to hold the arthroscope. And so I gave up performing orthopedic surgery due to this disability in the my musculoskeletal system. I'm very passionate about joint health, so I've switched gears and started a company to help people understand their bodies more and then utilize tips and suggestions and resources in order to get better and thrive and have less pain. Surgery is a tremendous modality. I fully enjoyed it. It was very fulfilling for me. But the recovery is half the problem, or half the ballgame, half the struggle. So by collaborating with a physical therapist, we created an exercise database that is simple, safe, and effective to help supplement physical therapy and get people optimized in their outcomes and to ensure better patient satisfaction after injury. So at PopDoc, we are that premier online joint health community to help people attain, regain, maintain, and preserve healthy joint function and to have less pain.
Absolutely. And I have actually had the benefit of getting to see the database and might or might not have used it for my wrist a time or two. And so I know in there you have, over 700 exercises currently, and it continues to grow. And I have on the screen just a display of an example of what an exercise might look like in the system and some of the things it focuses on. So what I want to know is some of the variety of purposes, and you kind of just touched on it, but from rehabilitation to maintenance to prevention, what can people use these self-care exercises for, and how it helps with injury prevention and recovery?
Thank you for that question. It's good and insightful and helps me just convey my thoughts and suggestions to that. Some people is a fearful word and it's vague, so they don't really know what that necessarily means. We provide controlled exercises and joint health activities, and therefore they are not a fearful exercise, but really activities specified per joint. And we also work on the qualities of joint function. So motion, tone, flexibility, strength, endurance, condition. These are all qualities of joint function that are conveyed through the musculoskeletal system. So musculoskeletal is anything having to do with the muscles, bones, and joints of the human body. So we focus on the most delicate and fragile aspects of the musculoskeletal system, and that is your joints. So if you can focus on your joints and get that motion and the muscles around it, if you can tone them, get them strong, conditioned, and able to have endurance, then it's actually protecting the joints. We believe that if you protect the joints during your everyday activities or your work activities, there's less likelihood of pain, and you can focus on the positive qualities of being at work, productivity, teamwork, and ultimately success for the company.
Absolutely. So, when it comes to these self exercises, obviously self is part of that. So, that means that we're looking at people who need to take responsibility for their own health. So, can you, I spend a lot of time at Dorne talking to people about we're here to help you engage your employees in their own well being. So, can you speak to the importance of what's involved in someone taking ownership and responsibility for their own well-being?
Yeah, I think you bring up a good point, and Americans, unfortunately, many of them they want the immediate gratification of a shot or a pill and sometimes surgery. But looking, their own healthcare journey is based upon themselves. They are the captains of their own ship. So if we can educate them, empower them, motivate them, and open up their eyes to something as simple as stretching before you do some activity, or listening to your body and not going for a run if your knee hurts. So by taking ownership, that means you have knowledge to do things, and then you're actually motivated to do them. And at PopDoc, what we try to offer is, at your fingertips exercise. So it comes right to your phone. They are simple, safe, and effective, and they are usually short, like 5 or 7 minutes, where you can do something for the joint that needs it, or the joint that you want to work on that day, to help you, take more control of your joint health. Because I think that healthier joints make happier people. And so if you have those healthy joints, you can be happy and focus on the other things in life that bring you joy.
Yes, and so related to this, because I agree, I think I've come across many people where it's like, well, my employees just won't use that. And I do think that it's something to do with kind of how our mentality and cultural aspects can be. But I know that you work as the executive director for an organization called Joint Education Outreach. So, just briefly, can you give some insight into the importance of developing these habits from a young age and how that helps people stay engaged in their own well being?
Certainly. So, as I stated earlier, I was a young athlete, so I was on the playing field, working out to try and get in shape. Because in the athletic field, at least, when the team is together and healthy, they are more successful. And building routines from a young age is easier than someone who's set in their ways, like a millennial or somewhere in the workforce. So at Joint Education Outreach, what we do is we empower the local healthcare providers to bring age appropriate we empower and encourage local healthcare providers to bring age appropriate multimedia presentations into the classroom to teach people. It's about essentially joint health 101, where we describe what a joint is, how it functions, why it functions the way it does, and the importance of taking care of it. Because once it gets damaged, it doesn't always heal itself. And the body is an incredible thing, but it does not regenerate the surface of the bone cartilage or your soft tissue structures in your joint. So by preserving them and getting good routines from a young age, it helps you listen to your body and understand your body a little bit more. So when you grow older and you want to stay active and do things you like, you can be mindful of yourself. And so we believe that if professionals locally and give back their knowledge and experience to local classrooms and schools, that it builds a bigger community that raises joint health awareness. Because in the business world, musculoskeletal disability costs businesses about $1 billion a week. And it's a huge expense. And I think that if people can take some more accountability for their health, whether it's diet, hydration, nutrition, rest, and just being smart about your joints, then I think that you can have much more longevity and much more productivity in the workplace.
That I agree with, and I know my generation, the millennials, we often go into the workforce with pre-existing conditions already, just due to some of the bad habits that we have. And so I want to dive deeper because I definitely think in an ideal world we would all be exposed to this knowledge from the get-go. But a lot of times people aren't learning about this stuff until they're in the midst of a very demanding, rigorous physical job. They're an industrial athlete in an occupational environment, and then they're, kind of left with pain and discomfort. So can you talk about the importance of musculoskeletal health and getting in the habit of exercises and how that relates to the overall reduction of injury risk?
Absolutely, thank you. And so I want to just pose an analogy to some studies that have been done in the soccer leagues professionally, as well as the youth baseball and softball leagues, that if they practice preventive exercises and get ready for their game and their specific exercises for specific sports, then these teams stay together more and they're more productive on the field, and the teams actually do better. So the individual suffers less severe injury and the team is more successful. And I believe that PopDoc.com is for the industrial athlete, it's for the layperson as well, because we can now treat anybody through knowledge and motivation and at-home exercise that comes to your phone like an athlete. Because those industrial athletes, they have very demanding jobs, even though they're not on the playing field, nor are they getting reimbursed to the levels that professional athletes get reimbursed, but they are still very important. And they are an asset to the team, and they are an asset to the employer. So by getting into these easy, quick routines that they can do to prepare for their day, or during their day, take 5 minutes to stretch out their shoulders or stretch out their arms or do something to wake those muscles up, to wring them out, to bring in new blood flow, to keep them healthy, then there's going to be less onset of pain. We'll be able to combat fatigue in the workplace, and people will be more productive and be able to focus on their job or their task at hand.
Well, I like the sound of that, but unfortunately, despite best efforts in some cases, injuries do happen. So, can you also speak to how these mobility and self care exercises can assist with injury recovery?
Certainly, absolutely. So we currently believe in partnering with those people so they can make a difference in their patients. They can empower them. They're with them one-on-one, and they can encourage them to get educated, take control of their recovery, and do their homework. So when somebody is injured, they go to a physical therapist, a chiropractor, a rehab specialist, but they're not with them 7 days a week. And so if they're with them 2 or 3 days a week, there's still 4 or 5 days a week that are there left. So we offer what's like essentially homework for the patients, very customized exercises to meet that person where they are and elevate the quality of their joint function. So by encouraging them to do their homework, in which the rehab specialist can track and monitor the usage of the injured worker so they can make them more accountable, get them back on the right track quicker, and diminish their pain and increase their function in such a way so they can get back to work a little bit faster or a lot faster. Everyone heals differently and feels differently, and certain jobs are more demanding than others. We like to meet people where they are, elevate their quality of joint function through the guidance of a rehab specialist, especially when they're injured.
Okay, so taking a little bit, I want to build on that because you mentioned, once a joint is damaged, we don't necessarily regenerate back to, 100%. And I know that I have spoken to a lot of people that the number one risk factor of an injury is having a previous injury. So, can you speak to how self care can also help you retain the improvements that you get as you've recovered so that you can prevent another injury from happening?
Melissa, I think you bring up a good point with that because the ankle bone's connected to the knee bone, which is connected to the hip bone. And that there's an old rhyme that nursery school rhyme that many people might know, because if you, let's say, sprain your ankle and you don't use it for 2 or 4 weeks, then your whole leg suffers. It gets deconditioned. It doesn't have the same cadence of walking. So these muscles get out of shape and deconditioned. So not only is there inflammation in the injured ankle, but the rest of the leg suffers. So by doing the right exercises to get your ankle better, you also got to do the right exercises to recondition the other muscles in your leg. So by doing self-maintenance exercises, you get to work on your entire body by maintaining that motion and that flexibility and that tone, which is that firmness to the muscles to protect the joints. And then you can ultimately build that strength and the endurance through conditioning. So we strongly believe that when you harness what you know and utilize the platform at popdoc.com, you can work joints around the injured joint to prevent new injuries. The number one reason for a recurrent ankle sprain is incomplete rehabilitation of the first one. So if you rehab it nicely and you work on the muscles around the ankle and around your leg, then you have better control, coordination, and stability. So by restoring all that and then maintaining it through those 5 or 7 minute exercises once or twice a day, you can prevent the onset of a new injury.
Okay. Okay. Yeah, that is fascinating and something that I think I can relate to. I had an injury not long ago where my left foot was messed up, but by the end of it, my right ankle hurt because of the way that it changed being on crutches. So I feel like I
Thank
just
you.
had an epiphany. So
Thanks for validating my thoughts also, because I want to acknowledge you. You are not unlike most Americans who have had some sort of injury that affected another part of their body. And you, of course, like hopefully don't like chronic pain and you want to be active and functional. So by doing the right things and having them in your mind or on your phone, you can do these things and hopefully feel better, function better, smile more, and be more productive in your life.
I definitely like the sound of that. So, related to another issue that's facing just current demographic trends is according to the Bureau of Labor and Statistics, workers 55 and older make up nearly 25% of the current workforce. And without meaning any disrespect, we do know that musculoskeletal and joint health undergo natural decline over the lifespan. So, can you speak to how these self care exercises can be particularly important to employers when they're looking to support the well being of their mature or tenured employees?
Certainly. I mean, I think you bring up a good point that there's normal aging and everybody ages at a different rate and level. And maintenance of musculoskeletal health is part of a healthy lifestyle to increase your health span as you go on. So it could be including a good balanced diet, adequate nutrition, hydration, rest, and being smart about the things you do. The I think the powerful and insightful employer cares about his or her employees because they know that they are their assets. So some of their assets are their employees. If they keep them happy and motivated and pain free, they're going to be more productive and they're going to lead to a higher level of productivity and success of that company. So it's important that whether they're 40, because some 40-year-olds might look 60, and some 55-year-olds might look and act 40. So it's a mix, and age like 55 is a number, and some people age quicker or slower or more gracefully than others. But even those older people, let's say in their 50s, who have that slow degeneration of just leading an active lifestyle for 55 years, will benefit from maintaining motion, tone, and flexibility of their joints. by moving the joints, what you do is you encourage those cells that are already delicate to compress against each other, and they therefore continue to spit out the solutions or the cells or the products that they do to keep them healthy. And I talk about the articular cartilage where it has no blood supply or nerve supply. So by just moving your joints around and impacting them on a controlled fashion, it actually gets the nutrition into those cells to keep them healthy. In addition, if your muscles aren't moved a lot, then they can build up lactic acid and they can build up metabolites of normal cell function. And by stretching, you wring out the muscle in a controlled fashion and it brings new blood flow there. So it helps keep those muscle cells alive and healthy and happy. So I think that the self-maintenance and the care that you can give your own musculoskeletal system is really can be in the palm of your own hand.
Yes, which I think we all are growing into the age where we like to have something at our fingertips. And um, related to the utilization and implementation of, employer programs, I know that in a lot of cases at trade shows or in different situations, I've spoken to people, and a lot of companies are still holding true to traditional stretch and flex programs. And I'm not saying they're bad or they're all wrong, but from your expertise, can you speak to what factors might be missing from those traditional programs and what employers can do to kind of update, bring up to speed with modern science those programs?
Yeah, absolutely. So modern science as well as new age technology is that if they embrace technology, there are new things coming out often. And one thing about some of these stretch programs is they're not done with live individuals or they're done with a video. And a video is great because you can turn it on and watch. But I'm a huge proponent of saying, all right, I want to look in my own body when I'm doing this sort of stretch or this sort of joint health activity. So we focus and use still imagery using a live model to create essentially a GIF animation. So it's very technically precise. And it's also, there's some text there to help people read about how to get from one place to the next. It also allows us to track and monitor a little bit better. So some of these video-based stretching programs can be too fast for somebody, don't necessarily focus on good technique, and they don't let you focus on your own self while you're doing the exercise, but rather you get lost in the video. Like, oh, I'm watching this person. I like their clothes. I like the way they move, whatever it is. So we believe that, taking that time to focus on yourself, be technically precise, and still get those great, effective, and satisfying exercise. I hope that
Yes,
answers your question.
it does. And what I really like, because as you know, we have, one avenue that we use, PopDoc.com, is through Dorne on the go. And I speak with clients repeatedly about the importance of a system like this as we can start to tailor exercises and conditioning, suggestions based upon the work that your worker's actually doing versus kind of a one size fits all, bend down, touch your toes, things that might not only, cause issues, but not really address the issues of the human body that a particular worker in a manufacturing plant has, or a worker at a major airline. Like things, I really like this customization aspect that makes it relevant, which I would think hopefully would make people more likely to be empowered and engage in their own well-being.
Yeah, I really appreciate that distinction, Melissa, because we are versatile and customizable. So if somebody who's a sedentary worker all day is different than your warehouse worker, who's different than somebody who's just on their feet all day walking around. So there are different exercises, and they can really just be customized such that they can give them one exercise or three exercises. And they say, look, do it before your shift and do it after your shift, and we can, make sure that you're doing the right things to feel better and function better. So we allow customization based on the employer needs as well as based on the worker type that we are addressing. And having Dorn in the on the front lines and working directly with the employee is very helpful because they can actually get some eyes and they put their hands on people and they can really be there, and we act as a great supplement to kind of work together to bring about a better outcome for the employer.
Absolutely. So I am really appreciative of your passion. And to wrap up, I just want to know, for the people out there listening, if you have one major message for them, what do you want them to walk away knowing or feeling even?
Sure. I think that you have one body and you have one life, and you might as well make the most of it. And I think that with a little bit of work, you can focus on joint security. You want to have familial security, you want to have financial security. Joint security is something that you can achieve and attain, and that's essentially holding on to your natural joints for your whole life. So it's about just understanding your body, being mindful of what you do with your body, being in a good lifestyle routine of hydration, rest, good diet, nutrition, a work type of work that doesn't overwork you, and listening to your body, and also doing those routines of exercise and joint health activities that are beneficial to you, the individual, more than anyone. Because who wants chronic pain? Who wants to be struggling with a cane, or have, be on opioids, or get out of shape and not feel happy about playing with your kids or grandkids or gardening or doing those things that bring you joy, as well as being a productive member of a working society. So that's a
Absolutely.
lot.
Well,
That's a lot to tell somebody, but I got a
hey,
lot to say.
hey,
So
I appreciate it, and I hope people do take away that idea that, maybe it's not about the idea that you go out and run a marathon tomorrow. Maybe it's about spending that 5 minutes taking care of that nagging back pain that keeps you from going on that walk after dinner. Things like that. I think finding ways to make small strides in the right direction is something that, we can all get on board with. So,
yeah, and I appreciate that distinction and your understanding of that, because many Americans are like me when I was 18 or 20 and just pushing through the pain. But maybe if I'd known a little bit better, I would have taken a few days off, and I would have sought some professional assistance through medical help, or at least maybe not have skied so hard, or not have done something that I wouldn't do now because I'm a little older and I have more experience in life and I don't like pain. And I hope
yeah,
most people don't like pain.
I'm learning the limitations of young age as we grow. I guess it really doesn't last forever. But
Yeah.
um, thank you so much, David, for taking time to speak with me today. I really appreciated your insight and information, and hope that our listeners out there did as well. And we hope that to have you on again sometimes, and we hope our audience out there tunes in soon for our next episode. So thank you.
So grateful to be here. Thank you so much, Melissa. Healthier joints make happier people.